In healthcare, following the rules is crucial. These rules exist to protect both patients and healthcare workers. They ensure everyone is safe and receives the best possible care. When healthcare providers follow the rules, they build trust with patients. This trust is essential for effective treatment. Imagine going to a hospital where rules are not followed. You would likely feel scared and uncertain about your safety. This is why compliance is so important. Healthcare compliance in South Africa has specific requirements. It means following all laws, regulations, and ethical codes that apply to healthcare settings. This includes national laws like the Constitution and the National Health Act. It also covers guidelines from professional bodies like the South African Nursing Council. Furthermore, healthcare institutions often have their own internal policies that must be followed. Compliance is directly linked to patient safety and the quality of care delivered. When healthcare workers follow proper procedures, they minimize the risk of errors. For example, correctly identifying patients before administering medication prevents dangerous mix-ups. Following infection control protocols protects patients from hospital-acquired infections. Compliance ensures that patients receive the right treatment at the right time. Everyone working in healthcare is responsible for compliance. This includes doctors, nurses, pharmacists, administrative staff, and even cleaners. Leaders within healthcare institutions have a vital role to play. They must create a culture of compliance where everyone understands their responsibility. Regular training and open communication are essential for maintaining this culture. Patients also have a role in speaking up if they notice something unsafe. Section 5. The Nursing Council's Rules for Nurses. The South African Nursing Council, or SANC, sets specific legal requirements for nurses. These rules cover areas like professional conduct, patient confidentiality, and medication administration. Nurses must maintain their registration with the SANC by completing required continuing education. They are also obligated to report any unethical or illegal practices they witness. Failure to comply with SANC regulations can have serious consequences for a nurse's career. Section 6. Patient compliance versus adherence. It is important to distinguish between patient compliance and patient adherence. Compliance traditionally referred to patients passively following a doctor's orders. Adherence, on the other hand, recognizes the patient's active role in managing their health. It emphasizes collaboration and shared decision-making between the patient and the healthcare provider. Promoting patient adherence leads to better health outcomes. Section 7. Consequences of not following the rules. Non-compliance with healthcare regulations can have significant consequences. For patients, it can lead to medical errors, infections, and even death. For healthcare institutions, non-compliance can result in lawsuits, financial penalties, and damage to reputation. Individual healthcare workers can face disciplinary action, including the loss of their license to practice. Creating a culture of accountability and ethical behavior is essential to prevent these negative outcomes. Section 8. Upholding high standards in South African healthcare. Compliance is the cornerstone of maintaining high standards in South African healthcare. By following the rules, healthcare providers demonstrate their commitment to patient safety, quality care, and ethical practice. This commitment builds trust, improves health outcomes, and strengthens the healthcare system as a whole. It is the responsibility of every individual and institution involved in healthcare to uphold these standards for the benefit of all South Africans.